do doctors do after quitting medicine? Non-clinical jobs for doctors. Watch this video to the end as I discuss the 5 most common non-clinical jobs that doctors can venture into in Malaysia. Hi, I'm Dr. Selina. I'm the founder of Medic Footprints Malaysia. Medic Footprints is a tribe by doctors for doctors. It's a community platform that connects doctors to diverse careers. Now, Medic Footprints Malaysia was started based on my personal journey when I left clinical medicine. When I left my job as a medical MO in the NS department, I was confused. I was not sure what I was going to do with my career. I studied 5 years in med school, 2 years of housemanship, 2 years in district posting, and then a couple more years as an NSMO. But all of a sudden, now I'm no longer seeing patients. I'm not in a hospital, I'm not in a clinic. What am I? Am I still a doctor? Is that the end of my career? Is there nothing else I can do? Now, all these questions started to pop up in my head, and it prompted me to search what are my career options outside of clinical medicine. And that's when I stumbled upon non-clinical jobs for doctors. So I have spoken to so many people, I've bugged and shamelessly harassed so many people, I've connected with so many doctors, and I found out that there are so many doctors out there that have made successful careers for themselves outside of clinical medicine. Now, if you resonate with my story, be sure to check out our website at www.medicfootprints.com.my, and also we're organizing our first ever Diverse Careers Summit for Doctors here in Malaysia, August 20th in IDCC Shah Alam. This is the place where you get to connect and talk to doctors who have made career change outside of clinical medicine. The link is in the description below. The first industry is the pharma industry. Now, for most doctors who are thinking of switching careers into non-clinical jobs, the pharma industry is usually the most common preferred choice of most doctors, and most doctors do very well in this industry. See, day in, day out, we're prescribing and treating patients. We're prescribing all the various kinds of medications to patients. So no one will see the effects of medication on the patient more than we do. We get to see how certain medication improves the patient condition or makes it worse. We see how certain drugs give the patient a certain kind of side effect that causes them to be non-compliant. We also see some patients preferring certain drugs over the other. See, no one sees the effects and side effects of the drugs more than we do, because we see how certain drugs make a patient feel better, we see how certain drug makes a patient feel worse, we see how certain patients prefer a certain kind of drug over the other, and we've also seen how certain side effect from a drug makes the patient non-compliant. And all of this is because we have so much interaction with the patient. Unbeknownst to doctors, these are the kind of medical expertise that pharma companies and biotech companies are looking for when they are creating, testing, and investigating new products. Now, if you're a doctor who loves research, this may be a pathway for you. Now, doctors who go into the pharma industry contribute so much more to public health than doctors who are seeing patients day in, day out. Now, if you found this video helpful, be sure to check out our website. We have abundance of job opportunities outside of clinical medicine. Also, remember to join us for our Diverse Careers Summit happening this August. You get to talk to doctors who have gone on into pharma industry. If you want to find out more about the different roles a doctor can get into in the pharma industry, be sure to check out our other video called Pharma Jobs for Doctors. The second is the insurance industry. The second most common non-clinical job a doctor gets into is in the insurance industry. Now, doctors working in the insurance company trade their lab coats for suits, but they still leverage much of their medical expertise garnered through school and clinical practice. The medical doctor's job in health insurance could entail conducting remote medical chart reviews or helping develop policies and guidelines for patients' care. You can also be involved in detecting fraudulent claims and making sure that the attending doctor in the hospital is treating the patient adequately. If you want to find out more what are the roles a doctor can play in the insurance industry, be sure to check out our other video on insurance job for doctors. Also, remember to join us for our Diverse Careers Summit, because we have doctors who have gone on into the insurance industry who are there, whom you can talk to and speak to about how you can transition and get into this field. I hope to see you there. The link is in the description below. The third most common is is hospital administration. Now, this role has become more popular to go into lately as hospitals are starting to realize the benefits of having doctors in their management team. A December 2016 Harvard Business Review article by Stoller, Goodall, and Baker cite a study which indicates that the greater the proportion of managers with a clinical degree, the greater the overall positive effect for a hospital. As a clinical doctor, you're the front-facing end where you treat patients. Now, the hospital administrator are the people in the back end where they make sure that everything works and functions so that doctors and nurses can do their jobs. So a person with knowledge of what a patient needs in his or her treatment, like a doctor, this doctor can better support and advise the management team on how to best run the hospital for better patient outcome. Now, if you want to find out what are the different roles that you can play and get into in hospital administration, be sure to check out our other videos and also join us for our Diverse Career Summit because we have employers from the hospital management side that will be there, whom you can connect with, network so that you can get a job. Now, fourth on the list is digital health startup. Now, in the last 5 to 10 years, there has been a big boom in digital health space in Malaysia. Now, you can join this startup as a doctor to provide either a teleconsult or as a content writer writing health articles for patients, or even as a product specialist where you tell them and you give your feedback on what works and what doesn't. You can even join as a business development person to help them develop new products for healthcare. The last on the list is start a startup. If you're someone who likes building things, thinking outside the box, always thinking, how can I make things better? You like to innovate, you like to push boundaries of products and services, or even if you want to create an app that could improve the way healthcare is, start a startup. Now, create a minimal viable product, get your friends, family to try it out, see if there's traction. If there is, pitch to investors. Or better yet, you can even pitch to us at Medic Footprints Malaysia and we can see how we can help you to get this thing off the ground. Even better, come to our Diverse Career Summit because we have investors there who are looking to invest in startups, invest in doctors who want to start their business and even help doctors just bring their business off the ground. Now, if you found this video to be helpful, please remember to like, comment and subscribe to our channel. Also, be sure to share this video with your friends and colleagues who are thinking of quitting medicine and doing some non-clinical jobs. Also, be sure to check out our Diverse Career Summit that's happening. The link is in the description.